Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health promotes integrative medicine by providing learning opportunities to health professionals and healthcare consumers. Today's facilitators are Julie Wendt and Mara Benner. Julie is a licensed dietitian nutritionist in Maryland, a licensed nutritionist in DC, and a certified nutrition specialist. She's presently an adjunct professor at GW School of Medicine and Health Sciences, and she's the founder of Julie Wendt Nutrition. Mara is an old friend of the AME community, and she's the Mind, Body, Spirit Director of GW Center for Integrative Medicine. She's also the founder of Four Directions Wellness in Alexandria, Virginia. So with that, I'll hand it over to you, Dr. Kogan, for questions.
Yeah, and thank you, Tanya. And also Mara was on a board of director of AIM some years ago. So just saying that, so we don't forget that. You know the drill, questions in the chat. If you absolutely must, raise your hand. I hope everybody knows how to do that by now. And we'll let you unmute yourself. Yeah, I don't want to entertain you. I'm sure there are questions, so don't hesitate. I did not see any questions from Janet before, so we didn't see any prepared questions, so I don't have anything to open it up with. No questions. Oh, there we go. Of course. All right. Eventually had my, thanks, Cecilia. Eventually had my Pfizer shots and booster. If we start getting early updates like we do for flu shot, do you think that I could get a Moderna? Right. The great question. That's actually going to be answered in the upcoming months with the research. The research from England seems to support this idea that cross covering is going to be fine. But there's now yet research from US that I have come across or that I've heard of. So I think stay tuned. We had a grand rounds on this topic a couple of weeks ago. The speaker was quite clear that chances are that the cross is going to be just fine, but it's premature to say what would be more effective. You all probably heard that it does seem to continuously, Pfizer is doing much worse than Moderna. Seems to be across the board, and not just in US, but in Israel and other countries. So is that going to lead to more and more people asking for Moderna just because that's what they're going to ask? I mean, who knows? So I think we're also going to see a lot of just cumulative data because people are going to do what they're going to do. And so there's going to be data just based on what we call a post-market analysis. Who should get boosters? Okay, great question. Thanks, Anne. So everybody over 65, according to FDA, there's a strong recommendation after 6 months. So if you had 6 months or more, you should be getting boosters. And of course, we discussed this already, if you have immune compromise for whatever the reason. Now, that did not get very well defined. Previously, it was already defined, and FDA already expressed to say that if you have history of organ transplant, cancer, and or you're on any kind of immune suppressant, then you should be getting the active cancer. You should be getting the booster. And then the last Friday, what was added is that 65 plus, and if there is any immune compromising condition, and they left it sort of broad. I guess that's really to be determined between you and physician, or if you strongly feel you're immune compromised, it's a fair game. They kind of left that room, I think, on purpose, because, you know, that's quite vague. Like, you know, what about 25-year-old who's on a course of steroids who has asthma disease? Is that person immune compromised? You start getting in a very shaky territory very quickly with that logic. But again, I think it's so that to allow a lot of room for interpretation. Sheila.
Hi, Dr.
Hi.
How are you?
Very good, very good.
Since there weren't many questions, I have one. But I don't know if it's a subject thing or what, but dating in the time of COVID, what are the protocols? You know, is kissing not gonna work ever anymore? It's, you know,
on a spot right there. All right.
you do?
Oh boy.
I mean, do you have any, or maybe we can talk about it later or something.
No. That's a great topic. I'm sure everybody wants to hear.
Nobody says anything about it. You have
So
to
I think it's a very critical question. I mean, I'm assuming your question has to do more with it's a first date, right? Or like a second date or something.
Yeah,
you don't know the person yet very well.
No, somebody you meet, going forward, this thing may last forever. So one minute you thought it was temporary, but now it looks like it's hanging around. So what do you do?
Right. So obviously contact of this closeness is absolutely the highest risk, right? So if the person at the moment where you're on a date is infected and could be asymptomatic, by the way, don't forget, right? So the person can be vaccinated, but could be a symptomatic carrier, right? So that is by far the highest risk when you're that close with someone, and especially when you're exchanging body fluids in any way. So I think the sort of most logical way to answer this goes like this. Well, first we'll get to know the person really well before you get to that level of contact, right? So, I mean, you can ask them what they do. What is their chance of exposure? I mean, somebody who lives in a isolated community and doesn't go out all that much and has a farm and mostly outdoors, I mean the risk is probably minuscule. And if I'm assuming the person is vaccinated also, right? So so that's one way to think about it. Somebody who's a high risk, let's say a healthcare worker who's in front lines and they're trying to be self-protecting, but how do you know 100%, right? So this is also a little different. And yeah, I mean, in some situations when somebody can potentially be exposed, you're going to take continuous risk if you're going to start to say, look, I am going to get involved here and I'm going to take a risk. So you're going to take a risk. I think that's where the decision has to be individualized for you. Once you get to know that person really well, presumably it's a good person. Why would you be dating them otherwise, right? Presumably in that situation, then you can have a very clear line of communications, because the same goes exactly for the person you're dating, because they're asking the same exact questions. What if they're not vaccinated, but you vaccinated? Well, you in some way have to ask yourself a bigger question then, right? So then potentially they're at even higher risk than you, because you may be also the silent or asymptomatic transmitter. Interestingly, there hasn't been any very clear guidelines on how to handle this. You can say, well, I'm going to have sex with masks on. I mean, come on, you have to be practical, realistic here, right? So that's not going to happen. You know that. And even if it does happen, short of both of you wearing N95s, it's just not going to work. I mean, the mask's going to move. Let me give you a simpler example. It has nothing to do with sex, but I go to jiu-jitsu with my son, with my 14-year-old. When the Delta came back, we are now required to have masks. Now, imagine the rolling, right? And everybody knows what jiu-jitsu is. So half of the class is a technique work, half of the class is a rolling technique. So imagine I'm rolling with somebody and I'm doing an arm bar grab and my hand goes and yanks the mask out. What, in the middle of it, I'm going to stop and have him reposition the mask? I mean, you have to think about things realistically. I may not even notice what I just did. So the reality is when you're in that close contact, all the sort of protective methods are not realistic, and so have to.
What about kissing? Now you getting into the sexual stuff, but that's pretty.
Well, it's a high risk, right? So if the person is infected, you basically, I wouldn't say guaranteed, but you're very high risk of passing it on to you. So your only way out of this is to say, how can I assure that this person in front of me is not currently infected? Obviously, if they're symptomatic, you shouldn't be meeting them. I mean, I think I don't have to explain that to anybody, right? So if they're exhibiting any symptoms that even remotely could be COVID, you shouldn't be meeting them at that day. I mean, wait for 10 days until they're sort of out of quarantine and then okay. But the problem is not that. The problem is, let's say that both of you vaccinated, and then there's a really significant chance that if they got infected, they're not going to have symptoms, but they can pass it on to you. Now, will you be lucky one to have no symptoms? Who knows? right? The statistics are you're not going to get serious illness. We know about that. But you will get potentially a illness, and some symptoms can actually turn into long COVID, even if you had mild case. So that's what I think part of your question is going to. I know I didn't give you a satisfactory answer, but there isn't going to be any satisfactory answers here. If
you said the rapid test was not reliable that much, you're saying.
Forget the testing in this situation. I mean, it's just not going to be. Well, think of it this way. When are you testing somebody? If they don't have symptoms, you cannot use the Abbott. I mean, you cannot use antigen. The sensitivity is so poor that it's almost like flip of a coin. So doing a PCR test, okay, I mean, what, you're going to test them 24 hours before you're going to see them for date? Like, or what? What if the test is not back? You're going to cancel the date?
Yeah.
Like, you know, think of all this. It gets to a point where your only way out is really to know the person. So I guess what I'm saying is blind dates are out for a while, people.
You know,
and I'm sorry about that. If that's your way of having a good time, I would say don't do it.
Thank you.
Yeah, thanks. It was a great topic. Oh, we took all our time for that. Oh my. All right, let's do a couple more questions and then go to Julie. German paper, there was a mention about small increase incident. Right. Okay. So this is a good question. I was expecting at some point to discuss this. So it's not that small of a risk. We now have thousands of cases of myocarditis in US after the vaccines. It's a more concerning disease in the young children, actually, and in a much older population. It's real. Thank God that 99.something% of myocarditis is self-resolving condition. It's an inflammation of the heart. People usually feel chest pain and they can get short of breath. So it could present itself scary, but it's almost always self-resolving. So there hasn't been a single death out of all of those thousands of cases of myocarditis in US. There hasn't been any deaths, which is good. And it's a real risk. So it's one of the few conditions which thought to be in an inflammatory state that appears to be clearly associated with the risk of the vaccine. So
I was vaccinated. I had COVID probably in February 2020, and then was double vaccinated a year later. What's my highest risk? Not getting the third booster and taking a chance that I really did have COVID and have super immunity, or is my better thing to get the third booster and maybe get inflammation because it'll be my fourth exposure?
So good question. It's not an easy answer because you also have to think through what is your current personal risk. So if you're older,
yes,
if you have an immune condition, booster makes sense. You know, there's no easy way to sort of say, look, should I go get antibody tested? That's not recommended because it's not going to be helpful to you. Right. So I would say that you're probably in basically just as everybody else in that same category. If you're 65 plus, go get a booster. If you're not, don't.
I'm 74, but really healthy. Good immunity.
Well, good. Go get a booster.
Okay, thanks.
I think there was another. Or was that, no, that was Elizabeth, I think that was your question. Do they still believe that COVID hangs in air for 15 minutes? I actually don't remember any of this anymore. It's been so long ago. I don't know. Does anybody can answer this? Lee, do you have any thoughts? I don't remember that.
I think maybe we hold that one for next week.
Okay, so we'll revisit for next week the topical exposure and sort of, do we gonna go back and wash our fruits, right? That kind of question. Okay, I got more homework. Okay, I'll do it.
I did have another question.
Okay.
I sent it to you, but I've never had a COVID antibody test, the rapid test. You know, you can get them free through the public libraries and I guess various places. Should one get that if you don't think you're being
not exposed? At all. Useless. Don't even consider that. But your other question, oh, sorry, that's not your question. So, sorry. Sorry, Cecilia, you down with that?
Yeah.
Okay. Jad had asked me a personal question, but I'm going to put it for everybody. It's really good. How do we interact with children, like grandchildren? Okay, that's a great question. So this is a hard one. And I already in clinical practice had this situation multiple times. So the kids right now, especially those who cannot still get vaccinated. So let's say the kid is 12 and vaccinated. Okay. consider that kind of similar to everybody else, how you interact. But what if the kid is 10 or 11 and not vaccinated and going to a regular school where the risk is clearly above average? That's a tough one. I actually would say that once they're going to the school on a regular basis, it doesn't even make sense to try to quarantine them, because they're going to be in a school, and so every day it's going to be a day of the working week, it's going to be different new days. So if you vaccinated and you absolutely have to see them and taking a risk, you're taking a risk, and be aware of it. Otherwise, more Zoom, less physical interactions, or when you meet with them, meet outdoors. At least for now, the weather is beautiful and we can do that. Once the winter comes, what we're going to do, I still would say meet outdoors. I'm not kidding. Or meet in a way where the ventilation is much better. You're decreasing risk of any real exposures. So.
Wow.
All right, with that, perfect, because I think I took care of all the questions. Remember the new rule, no questions after Mara goes. So it gives me a special pleasure to introduce our own Julie Wendt, Julie, you were here before, right? Or is this the first time?
So, yeah.
Really? How's that happen?
I know.
Okay. Well, anyway, Julie has been around forever. She's teaching with Dr. Frame as one of the faculty at the Integrative Medicine program. She's been nutritionist at CIM. Now she's on her own, and now she's going to tell us about the book we just finished writing, and she's going to tell us a lot of other great things. So with that, welcome, Julie. I'll mute myself.
Thank you. It's lovely to be here with you guys. I'm very excited to meditate with Mara in a little bit. So that was a big draw to be in the company of such great people. So I am a licensed nutritionist, and as Dr. Kogan mentioned, very excited about the production of my first book. Dr. Kogan's been at this a while. But we're co-authoring a book on integrative geriatric nutrition, and it is a clinical guide. So it's very hands-on, very solution focused, and is addressing all of the things that we see most commonly as we serve the older adult population. So I'm not sure when exactly that's coming out, but should be within the next month or so.
And Dr. Frame wrote a preface, just saying, and it's really good written. Julie, you're way too optimistic. It ain't happening. I mean, if we get a book out in 6 months, it'll be actually probably quite good. Usually, I mean, we just submitted everything, and I think there's still one more round of back and forth, but usually it takes about 6 months from the moment they took all the proofs to the moment it gets out there published. But we can take requests if anybody's interested.
Yeah, we could have a little raffle to see who gets the closest. They get a free book. All right, so today I was invited to talk to you guys a little bit about how food can support your immune system. And I don't have a ton of time, and it's a huge topic. So I really wanted to distill this down and make sure that you guys are getting the highlights. When I was thinking about this, I definitely wanted to highlight a nutrient that we have very solid research around in terms of improving outcomes if we do fall ill to COVID-19, and that is vitamin D. So hopefully everybody is already on top of this. If you are not, having sufficient vitamin D levels is critical to reducing risk of negative outcomes. So if you don't know what your levels are, it's easy enough to get that checked, and it's fairly safe to supplement with 2000 IU of vitamin D a day, just to make sure you've got your bases covered, especially as we go into winter and our exposure to sunlight is going to be reduced. So that's a plug for a nutrient that is actually somewhat difficult to get through food. So that's why I wanted to mention that first. Now, if I think about food and immune resilience, I think about them in 5 different ways, because there are 5 different ways that we can use food to support our immune system. The first way is around balancing inflammation. So we want to think about anti-inflammatory foods, which are going to be high in nutrients like omega-3s. So those are anti-inflammatory fatty acids that you're going to find in fatty fish like salmon and anchovies and sardines. And also you can find them in plant-based nuts and seeds in very high amounts. And so those are great ways to balance inflammation in your body. Another way is through turmeric. So that is a spice that's often found in curries. And you can actually buy the root in a lot of grocery stores, definitely Whole Foods. It's beautiful orange color, and that contains a lot of anti-inflammatory compounds that will help balance out the inflammation response. And then, of course, different flavonoids. And those are a type of antioxidant that you'll find in colorful fruits and vegetables. So thinking about balancing inflammation, anti-inflammatory foods is sort of the first approach that I want to make sure you guys have on board. The second is to balance out your blood sugar and insulin sensitivity and make sure that you're choosing foods that are well balanced. So every time you're eating, looking for foods that have protein, nuts and seeds, legumes, chicken, fish, all of that. That also contains healthy fats, because that's another way to make sure your blood sugar stays stable. Healthy fats will include things like olives and avocados, and of course nuts and seeds. You'll see a theme here. There's going to be foods that keep showing up, and also complete carbs. So carbohydrates that haven't been refined and have all of the fiber intact still. So whole grains and vegetables, starchy vegetables in particular, like sweet potatoes, and we're getting into the squash season, winter squash. Those are all great ways to make sure your blood sugar stays stable and your insulin stays at a healthy level. The third thing to think about is your microbiome. So everything about your microbiome is supportive for underlying immune health, in part because so much of our immune system is in our gut. So when you have a healthy microbiome, your gut is healthy and your immune system is functioning well. And the thing that your gut likes most in terms of feeding your microbiome is fiber. So high fiber foods, everybody's shooting to get 30 to 35 grams of fiber every day is really helpful for your microbiome. And we're going to find fiber in foods that have carbohydrates. So whole grains, beans are fantastic. They've got lovely protein, fiber, and healthy fats. So incorporating those on a regular basis in your diet. And there's certain foods that are particularly high, like raspberries, super high in fiber. So, taking a look and making sure, doing a little count to make sure you're getting that 30 to 35 grams a day. And then another food that's really great for your microbiome are the fermented foods. So things like sauerkraut, kefir, kimchi, have natural probiotics in them that can really help support a healthy microbiome. My fourth area I wanted you guys to think about is around your stress response. Stress is a lot these days. So thinking about how to balance that out with food is a lot about managing your blood sugar, because that can trigger stress response if your blood sugar drops, but also thinking about your caffeine and your sugar intake, because those are both things that can stimulate a stress response as well. And sugar in particular is difficult for your immune system. It kind of creates a negative microbiome balance. So thinking through not only what you're adding, but avoiding is important when you think about your stress response and how that affects your ability for your immune system to work well. And then the last thing I wanted to think about in terms of immune resiliency is optimizing your nutrients. So there are certain nutrients that our immune system relies on heavily for optimal function. And, you know, I can go through a long list of nutrients: vitamin A, vitamin C, we already talked about vitamin D, different antioxidants like quercetin, minerals like zinc. Those are all important. But to simplify it, a nutrient-dense diet is going to be full of all of the lovely foods that I've already mentioned. You're, you know, looking at your plate and making sure you're seeing beautiful colors represented across different types of fruits and vegetables, looking for healthy fats, and things that are going to create this anti-inflammatory, well-balanced, nutrient-dense diet. So all of the work that you guys are doing towards improving and making sure you're getting, let's say, 8 to 10 servings of fruits and vegetables, not only does that make you feel better, but it also helps your immune system work better too. So with that, I would love to answer any questions, and I apologize for going so fast. Hopefully you guys caught most of that.
That's amazing. I just have to say that this is why you're my right hand in the nutrition program. And I would also add that I did a similar talk about a year ago, and you pretty much hit the exact same things that I did. So this was a good refresher, and you presented it in different ways. So hopefully people learned differently. So well done.
Thank you.
And Mara, you're up. We're excited.
Yep, Mara. Thank you.
Absolutely. So it is so much fun for me to go right after Julie. It is like she and I are part of the team at the GW Center for Integrative Medicine with Dr. Kogan. So it's such a pleasure to be with her today. So thanks so much, Julie. Good reminders for me. And I'm trying to get off that caffeine. That's not an easy thing to do. So thank you so much. So hi, everyone, Mara Benner, and I wanted to talk to you today. I'm actually wanting to I just felt really called to do this meditation with you today. It's a meditation that was done by Norman Seeley, and I just think it's such a powerful meditation. I'm really hopeful you'll enjoy this as well. You know, as we've looked at COVID, and of course, there's so much related to it, a lot of grief, a lot of loss. But at the same point, COVID metaphorically is talking about an important lesson of recognizing how we are all interconnected. And so globally, I think COVID has helped us realize that there's this virus that can go around and overnight have us all staying in together and all facing the same challenges and situations. So it's just fascinating. So today's meditation is to hopefully take you to a place of thinking about different types of perspectives, especially in a world right now that's so divisive. It's often important for us to be able to really step in the shoes of others to try to gain perspective and understanding. So with that, I'd invite you to please take a moment just to come in. A couple of things that I always encourage everyone to do is please make sure that you're in a safe place, that your chair's safe, so that if you're able to fully relax and release, that you're safe where you are. So just kind of taking a moment, making sure that your feet are nice and warm, that you feel comfortable, and just coming in. So taking this time just to bring your awareness to your breath, gently closing your eyes if you haven't. You know, our breath helps anchor us in the present moment. So as you're able, please take those deep belly breaths in. Slowly and gently exhaling, releasing and letting go. And just take a moment to recognize where it is that you sense your breath. For instance, are you sensing it through the belly? Are you becoming aware of it in the chest? Or maybe it's through the nose that you really sense the breath going in and out. The best thing about meditation is there are no wrong answers, right? So wherever it is, that's perfect. Now I want you to just bring your awareness down to your feet for a moment. As you're able, go ahead and squeeze the muscles of your feet together and then release, letting go. And come up to your calves and tighten the calf muscles together. Release and let go. And then gently coming up to your thighs and tighten the thighs and the muscles of the thighs and release, letting go. Go ahead and take another deep cleansing breath in. Really filling up that belly. And then slowly and gently exhaling, releasing and letting go. Good, and then come up to the abdomen. Go ahead and tighten the abdomen muscles together. Release and let go. And then bring your awareness up to your shoulders. You know, it's the shoulders and the neck area where we carry the challenges of other people. That's where we place the burdens of others. So just take a moment to move your shoulders up and back and around, just releasing that, letting go of others' issues and burdens, letting them go from your shoulders. Good. And then bring your awareness down to your hands and go ahead and make a fist with your hands, tight, tight, tight. Release and let go. And again, taking another deep cleansing breath in. Slowly and gently exhaling and releasing. And then next, coming up to the jaws and just gently move your jaw to the left, to the right, just letting it go. And you might want to move your neck very gently to the left and to the right and forward and go back. And then finally coming up to the forehead and squeeze the muscles of your forehead together and release, letting go. Good, and then just gently coming back into yourself. So just take that deep cleansing breath in, releasing and letting go, letting go. Good, so now I'm going to ask you to use your imagination. And I want you to go back to this morning when you were brushing your teeth. So bring to your awareness that moment in the bathroom. You might feel or sense the toothbrush going over your teeth. Bring that into your mind. You can feel the water. You might even hear the water running from the faucet. And you might feel the coolness of the floor around your feet. So take a moment just to bring in all sensations. Being fully aware of them. Noticing what you're seeing, what you're sensing, what you're hearing. And then take a moment to look at yourself as the reflection in the mirror. Look at your beautiful face. Noticing and sensing that. And I want you, if the mirror is not, I want it to become a full-length mirror. It's a magical mirror. So allow it to become full length. We don't often take the time to reflect on our amazing body. But take a moment to do that now. Send some appreciation to this amazing body that when we provide it with the right nutrients and really help to support it, does such amazing things for us. So looking at that, noticing you in all of your beauty and glory. And then take a moment just to notice those areas that we're always so used to seeing, the challenges that we might have in the physical body. Just noticing those. And because this is a magical mirror, I want you to imagine that you can change your body any way you want. So go ahead and feel or sense those changes taking place. Making whatever changes, seeing that shift take place. And when complete, I want you to notice or sense how you feel in the body. How has this changed? What's different in the way that you feel? Really bringing that in fully. Noticing and sensing any of the changes. Maybe your clothes feel lighter. Maybe you've taken on more of an athletic feel. Just noticing and sensing that. And so now let's go for an even deeper perspective. So I want you to look in the mirror. And as you do, I want you to change your sex. So of course, if you're female, you'll change to male. And if you're male, you'll change to female. Really take a moment to fully encapsulate how that feels. What's different? Notice how you're feeling. Notice the changes in how you feel. Is it more empowering? Do you feel more vulnerable? Do you like being the opposite sex? Really sensing or noticing that. Now from that perspective, let's change it up once again. And this time, I want you to change your ethnicity. Move in to a different culture, a different feel. Noticing where you are now, who you are now. And noticing how you feel. Again, noticing if this feels empowering or what the changes feel like. Taking a moment to have a different perspective and sense. And as you do this, as you make these changes, asking yourself to become more aware of what the takeaways are. Noticing and sensing those changes. So once that feels complete, I want you to once again come back into your own body. It's accurate that we're all spiritual beings having a human experience. So allowing your spirit to come back in to the beautiful body that is yours. Taking a moment once again to look in the magical mirror. Seeing and feeling that. Sensing it, so bringing your awareness into your feet. Feeling that energy into your feet again. Feeling it in your legs. Bringing that energy fully back into your legs again. Feeling the energy enter into your core part of your body, into your hands and fingers, and then back into the shoulders, neck, face, and head. Good, and then whenever you're ready, just gently starting to come back in again by wiggling your fingers, wiggling your toes, and gently entering back in. And because this is a little different meditation, and I saw that we were getting some comments in the chat, I think it might be good for us just to open up and talk a little bit about the exercise. So I was hopeful that we might have a little bit of a discussion. How was that for folks? One comment was, I don't wish to be a man.
That's me, Irene. I was thinking, however, that if I were a man, I'd be able to be among lovely, caring women that were thinking about boosting my ego and taking care of me and asking me what I wanted for dinner. And are you all right? It would be fun to be a man, to have women take care of me. That was my second thought. And then I wanted to be Native American so I could have a feeling of knowing that you are in a place where you have always been and always belonged, we who are from multiple cultures and very American, that we come from many places, there's always a feeling that you're from here and from there. And it's wonderful to know that you're European and all of these things, but it would be nice to know that you are one thing and that you are where you have always been. It would be very nice. Thank you.
Thank you, Irene. Good. How is this exercise for others? Anybody else wish to go? I'm just curious if anyone had the thought of, oh, I'd love to be that opposite sex. That's where I really want to be, right? Anybody have that? No. And hopefully as you did this exercise, I mean, it was a very quick kind of meditation overall, but even just getting that sense, did you notice the difference as you move from your own body to even the different sex? Could you feel and sense that change in how you might feel? And then switching to a different ethnicity. Anybody else wish to talk about it a little bit? Any other insights that came up from it? And so Jade says that she found herself being resistant to doing it. Okay. Yeah, and that's a very typical feeling. So thank you very much for sharing that too. That makes sense. Just to kind of go with that can be a tough thing. So I appreciate you saying that. Dr. Frame says that it had her feeling empathetic and compassionate for others. So it gives us a chance to explore a feeling of how others may feel. And in a time in our culture when there's such divisiveness, it's sometimes important just to take a step back and be able to at least try to understand where another one's coming from. What? Correct. So thank you. Yolanda said it was a wonderful exercise. So good to hear. Let's see. Jennifer says, letting go led to drifting into a sleepy, dreamy place. I imagine feeling stronger as a man and angry as a person of color, right? So it's an important thing to recognize those feelings and emotions that you might have. So thank you very much, Jennifer, for that. And Luann said that she felt like I moved from one side of my body to the other. Interesting. That's awesome. Thank you, Luann, for that. Good. Well, wonderful. So thank you all so much for being a part of that exercise. I hope you enjoyed it. And Dr. Kogan, I know we had some 10 more minutes left. So did you wish to go back?
Nope.
Okay. So
no, we sort of established the rule that let's not go back to questions.
Yeah.
So I think it's really good time to share a little bit more.
Okay.
Not necessarily about this exercise, you know, maybe we can share a little broader as to what have we been finding mind body wise that's been very sustaining us. I can share a little bit myself, and I'm actually okay sharing this. So I got acute Lyme, and it was pretty severe. I actually ended up with a heart block, and I had to almost got hospitalized, but got sort of diagnosed in time, and you know, thank God for antibiotics, I got quickly better. But I realized that last weekend I had to really not just take a break, but really kind of just go deep and recharge. So I thank God it was a time when friends of mine were organizing a retreat upstate New York. So I drove over there and we did a very serious sweat lodge ceremony with a shaman from Mexico. And I think wherever we can, we should look for the opportunities like this, even when or especially when I think our body tells us to slow down and puts us at the place where no matter what the inner meaning of this event is, on a more external level, even though I was feeling a lot better, I think there was a shock to the system on a kind of a more mental and emotional state. I don't think I've been that sick for, I can't even remember how long. And so kind of recovering quickly also meant for me to go deep into the capacity of just really dropping everything out, going into the nature, going into very deep space, just the way Mara led us through the experience. So I did this for the whole weekend. So I guess what I'm trying to say, to me, the retreats have always been the place of respite and the place where I can go very deep and recharge on a multiple levels, not just on a physical and emotional, but on a spiritual and on a mental, and energetic. You know, I think it was also a very deeply energizing event. It was also equinox, so I think this was an equinox celebration. So.
Yes.
Yeah, and Luann is right. COVID made us all slow down, and I think there are continuous messages all around us that we have to honor that, and we have to be able to find external and internal resources that can nourish us this deep way.
Good. So everyone needs to, you know what I loved in seminary was they talked about how there used to be, we used to have a Sabbath, right? Every Sunday, you did not do anything during the whole day of Sunday. You really just took time to be yourself and to be. And so I think to Dr. Kogan's point, it's such a great thing. He was able to go away for a retreat. But COVID, to Luann's point, is all about us coming back into ourselves. And so it is about where can you get a retreat, even if it's just putting in 10 minutes a day, even if it's just putting in, if you can stretch it to a half an hour, but just thinking about how you can do your own type of Sabbath to be able to recharge the engines and to be able to connect to something higher if you wish. And nature is a great way of doing that, right? Getting out and forest bathing, especially in this beautiful weather right now. I see others are talking about nature as well. So that's a great opportunity to be out.
Yeah, I think retreat doesn't necessarily mean you have to sort of be out in the nature for a weekend. I mean, I had money and way of doing this, and thank God for my wife who said, just go, you need to recover. You know, the retreat could also be half an hour in the middle of a day, dropping things out and then just doing what we just did with Mara. You know, I think it's all about the depth of attunement and depth of the practice. And the length here is important to some degree, but don't ever underestimate 10-minute profound deep meditation. Sometimes the experiences there are very deep.
Good. I think that's all the chat that we've had. So thank you all so much for this opportunity. It was so much fun working with Julie and Dr. Kogan and Dr. Frames. Thank you so much.
Thank you, everyone.
Thank you, everyone. Wonderful meeting. Thank you very much.
Thank you, everyone. Have a good week. Bye-bye.